Welcome to Schloss Leopoldskron in the Salzburg Global Seminar. My guest is taking part in the first of a series of Salzburg seminars on health and healthcare issues. Richard Smith is the director of United Health, and you were once also a TV doctor. But tell me first, what is United Health? What do you do?
I'm not the director of United Health. I'm the director of the United Health Chronic Disease Initiative. United Health is one of the biggest health and well-being companies in the US, and it does a lot of different things, which perhaps I won't go into in detail, but what I'm doing is directing a philanthropic program called the Chronic Disease Initiative, and together with the National Heart, Lung and Blood Institute, which is part of the National Institutes of Health in the US, we have created 11 centers in low and middle income countries to counter chronic disease. And by chronic disease, I mean cardiovascular disease, diabetes, chronic obstructive pulmonary disease, and some cancers. And what these have in common is that they're largely caused by smoking, poor diet, and physical inactivity. And they're actually sweeping through the low and middle income countries at the moment, become the major cause of death in almost all countries, apart from some sub-Saharan countries where infectious disease is still very, very common. And up until now, there's been lots of talk about doing things, but comparatively few resources. So we're some of the first people to be developing research, policy, training, programs to counter chronic disease in low and middle income countries.
And would this come under the broad umbrella of healthcare reform, which is the subject of this particular session which you're taking part in?
I suppose it might do, although mostly here the conversations we're having are about health systems and how can you change them to make them higher quality, lower cost, more efficient, more equitable. So it sort of relates. But I think I'm here wearing, I wear a lot of hats. I have about 8 or 9 different jobs, and one of which used to be that I was the editor of the BMJ, and that inevitably led me to think a lot about policy. And as you can see, I'm kind of old. I've been around for a long time, so I've met a lot of people. I've been involved in all sorts of discussions. So I hope I have something useful to contribute here.
When you were a television doctor, you were a real Dr. Richard Smith, not a fictional one.
Yeah, I wasn't. Well, I hesitate to call myself a real doctor. I mean, I trained in medicine in Edinburgh. I did 2 years as a junior doctor in Scotland and New Zealand. Well, that was a long time ago. And if you keel over here now with a heart attack, I think I'm going to be very little use. So I'm sort of a realish doctor. Yes, no, I wasn't like Dr. Kildare or, and in fact, in the end, I did it for about 5.5 years. I was ultimately replaced by someone who was called Britain's sexiest doctor. They thought, we don't need this kind of rather withered-looking guy. Let's get someone more beautiful in.
Well, your imagination will have to be stretched now, because is this your first visit to Schloss Leopoldskron?
Yes, it is. It's not my first visit to Austria. I've been many times to Austria, but I've not been here before, and it is really rather lovely.
Well, I'm sorry to tell you that you're soon to be leaving this Alpine Palace. And across the lake, you can see a mountain, that is the Untersberg.
Yes.
And you are shortly to be stranded for a very long time on top of the Untersberg. But
right.
I will allow you to take 3 works of art, literature, or entertainment to the top of the Untersberg to keep you company. What would your first choice be?
Well, my first choice will be Montaigne's essays. Montaigne was a 16th century Burgundian writer. I mean, his first language was Latin. He's extremely well known in France and French-speaking countries, and pretty well known in English-speaking countries. And they are the most human, wonderful, insightful, amusing kind of essays. But one particular one is very important to me and very relevant to this debate around health reform. It's called "To Philosophize is to Learn How to Die." And the argument is that, we have to learn to deal with death. We're all going to die. And a lot of people try to deal with it by pushing it away, pretending it's not there. Montaigne says we should do the opposite. We should think about death all the time. We should recognize its importance. And we should recognize that in many ways it gives life meaning. I mean, to go on forever would be unbearable. So I think it's a really, I recommend it to everybody, and it relates to health reform. I've got a friend who trained with me in Scotland, and he has a line that says, in Glasgow where I was born, death was viewed as imminent. In Canada, where I did my master's degree, it was seen as inevitable. In California, where I live now, it's viewed as optional. And I think, the world, unfortunately, is moving in the California direction, not the Glasgow direction. And, enormous amounts of resources are going into fending off death towards the end of life. And I think what's particularly tragic about that is that often it's not only is it costing a great deal, but it's actually causing a lot of distress. And I think a lot of people in Western societies are dying very badly. So I think reading Montaigne is a very good way to counteract that.
And your second choice?
Well, I think one of the very best books I've ever read on healthcare is called The Spirit Catches You and You Fall Down by Anne Fadiman. Anne Fadiman was a journalist and really a wonderful writer. And it's the story of a child in California, a Hmong child, that's a group of people who came from Cambodia after the Vietnam War, who might unkindly, be described as kind of Stone Age people. So their response to illness would often be to slaughter animals. And the child had severe epilepsy. And it's the story of how both her family and the California health system tried their absolute best to do well by this girl, but actually it was just a disaster from beginning to end because they just didn't really understand each other. And Anne Fadiman came along afterwards and told this whole story. And in the end, it's an uplifting story. It's an extremely readable book. And I think it spells out to us how there can be a very, very considerable gap between the system and the people. Now, that in some ways was an extreme example, but I think I see it everywhere in Britain where I live. The gap between hospitals and people can be very considerable, and even between general practices, family doctors and their community. It's a big gap, and somehow the more we can close that gap and understand each other, I think the better we're going to do with health reform.
And your final choice?
My final choice would be for a bit of fun. It's The House of God, which was a best-selling book. I mean, it's the story of a junior doctor in the House of God, which is a hospital in Boston. In fact, it was the Beth Israel. I mean, everybody knows that. And it was written by a young doctor. And it's a very funny book. I think I describe it as like the catch-22 of medicine. And it's a deeply kind of cynical, shocking book in many ways. But it's very consoling often for young doctors because it sort of describes really the brutality of being a junior doctor, which is not so different now from how it was then. And by reading this book, you're not only fascinated and amused, but you sort of are comforted in some way. But I think for a patient, it could be rather a terrifying book, actually. But it sold 2 million copies, and I don't suppose it was bought entirely by doctors.
Well, now, in the event of a blizzard, you might find a little cave on the Untersberg to take shelter, but you will only be able to keep one of those works, one of those books. Which one would you hang on to?
Well, it would definitely be Montaigne's essays. I mean, not least because actually the copy I have of Montaigne's essays is that thick. So it's going to take me quite a while to read my way through all the essays, not just to philosophize, is to learn how to die. And it's very, very rich writing. So although it's easy to read and seems remarkably modern, I mean, this man, Montaigne, was a contemporary of Shakespeare's. It's one of those books I don't think you'd ever get to the end of it. It's almost like poetry, I suppose.
Richard, thank you so much for being our guest on the Untersberg.
Well, thank you.